Hi everyone, I'm Veronica. I am the nurse injector for the Kaplan Center. I practice under Dr. Kaplan and also trained by him. I've been a nurse for a little over 5 years now. I was a nurse at a well-known hospital for most of that, and then I decided that I wanted to specialize in plastic surgery and learn all the ins and outs about that. So I made the transition to work with Dr. Kaplan. A nurse injector is a registered nurse or a nurse practitioner who injects Botox, neurotoxins, fillers. In terms of cosmetic procedures, a registered nurse that is certified in injecting neurotoxin and fillers, we can do that under the practice of a doctor. It could be a plastic surgeon. I know dermatologists and even dentists that inject, and have nurses that inject under them. We cannot do surgeries. Obviously, that is the doctor's within the doctor's scope of practice, but we can assist in the surgeries. Myths related to nurse injectors. I've heard a couple. One time somebody mentioned that they heard nurse injectors were very aggressive with their treatments. I've heard that maybe some people may think the nurse injector is not as qualified. I've also heard people say that getting injected by a nurse or nurse injector is not safe, and all those are myths. What makes all of those myths is that to be a nurse injector, you have to be certified. You're obviously practicing under a doctor who knows what he's doing. I chose to practice under a board-certified plastic surgeon like Dr. Kaplan, who has been basically my mentor and is teaching me and has taught me many different techniques, the muscles of the face, the bone structure, proper techniques, proper sterility, and basically all the ins and outs of injecting a person's face safely, and also what looks aesthetically pleasing. So the hardest part about being a nurse injector, I would say, some people are apprehensive or nervous when they come in because they're like, oh, okay, the nurse is injecting me and not the doctor. Are you qualified? And right away they kind of have that wall up. So I usually obviously try to be confident in my work because I know what I'm doing, but once I talk to them and kind of break that wall down, they usually are very comfortable and happy with their results and also the way I treated them. Okay guys, bye. Thank you for listening. Thank you for following us on Instagram as well as Vo Aesthetics. Don't forget to subscribe to our YouTube channel. And if you ever have any questions, you can leave us messages on our Instagram and we'll get back to you.